Hello guys, today I want to talk about preeclampsia. There's something we call preeclampsia in pregnancy. Preeclampsia is the presence of hypertension in pregnancy with proteinuria that is diagnosed after 20 weeks of pregnancy and that resolves just about 6 weeks after pregnancy. Now 20 weeks is about 5 months. So if you are pregnant and you have not registered up to 5 months, you are not doing yourself good. My name is Dr. Preeclampsia. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Subscribe to my YouTube page at Dr. Preeclampsia at Talks-with-Dr-Adazion. Follow me on Facebook at Talks-with-Dr-Adazion. I'm on TikTok and on Instagram with the same name. Now, preeclampsia. I watched a video about a young lady, I think her second pregnancy, and they said after her cesarean section, she started complaining of headaches, and she died. And someone was attributing it to pressing of phones. I said, wow, pressing of phones. Okay, I don't know the medical condition that is called pressing of phones. However, now let's talk about preeclampsia because I suspected that what she had was preeclampsia. Preeclampsia, if you are 4 months and you have not registered and you are pregnant and you want to show us Hebrew women's style of pregnancy, my dear, you're on a very long thing. If you are expected to book for your antenatal after you have missed your second period, except if there is any other indication why you need to book earlier. So you have missed your first period and you meet your second period, you should book antenatal. The doctor will have to evaluate from finding out where the pregnancy is to be sure it's not an ectopic pregnancy. Anyway, that's not why I came today. So at 20 weeks, we start monitoring you anytime you come for antenatal. And if you note elevated blood pressure after 20 weeks, that's after 4 months, we start getting the notification that something may want to be happening. Preeclampsia goes with elevated blood pressure and protein in urine. It's a condition of pregnancy, one of the medical conditions of pregnancy. However, it can be managed. When we notice that, or if I found someone, a risk factor in someone, why we think the person may have preeclampsia, even before 20 weeks, we'll take over. We'll start giving the person some drugs to help prevent her from getting that preeclampsia. If we notice elevated blood pressure around that 20 weeks and you have visited earlier, we'll start giving you another drugs to prevent it, so that peradventure even wants to happen, let it not happen. Now, we'll continue to monitor the person. That's why you see, if you come to a good hospital when you are pregnant, they will check your vital signs. They will check your vital signs, among which is your blood pressure. And they will tell you to go and get urine. The urine, they will do a dipstick. They will check for glucose and they will check for protein. No matter how small the clinic is, these are the two most important things that will be done. So when a preeclampsia is noted, the person has protein in urine and has elevated blood pressure, we'll start taking note of what to do. We'll start classifying it. Is it mild? Is it severe? Now, when it is going out of board and you have not reached your 7 months, which in Nigeria we say is the age of viability. Some other countries have 24 weeks, some has 20 weeks, some has 22 weeks as their age of viability. This age of viability depends on what we can salvage. So when someone has presented with that, we manage the person. If you're in the hospital, it can be managed. But if you have not come to the hospital, because it may not even give you a sign, it won't give you any symptom, except if you come to the hospital. You may not even know that anything is happening to you. So when you present, we take over. There's a special drug we'll give so that the person will not convulse. If you start having symptoms of severe throbbing headaches, followed by flashes of light, you see, if you have flashes of light, plus or minus blurring of vision, plus or minus epigastric pain. Remember the plus or minus I'm adding. What it means that it may or may not be there. Any of these things I'm mentioning now could be associated with that hypertension and protein in your urine. So when we get this, we know that it is preeclampsia with severe symptoms. In fact, most of us will call it imminent eclampsia, because if nothing is done, you can convulse. And when you start convulsing, that baby, whether is viable, whether it's okay, whether it has reached or has not reached, will have to come out and be taken to the newborn special unit. Now, when we check this, we'll give you drugs to prevent you from having further complications, because other complications that can arise include, you can have stroke, you can have what we call herpes syndrome. Your blood will start hemolyzing, your liver will start getting damaged, it may even rupture, your liver enzymes will be way high, and you will have low platelets. When you have this thing we call herpes syndrome, my dear, it will take more help from the medical professions, more help from God, so that you don't enter into a very bad situation. Because when you have that low platelet, you start bleeding from every orifices. You will start bleeding that even if you want to take you for surgery, you will not be able to control it. So you now have to spend more. You have to get us fresh whole blood. You have to get slow cryoprecipitate. You have to get fresh frozen plasma, just for us to help control that bleeding. You see, hypertension in pregnancy is not something to joke with. So this can happen before pregnancy. Most times when we deliver the placenta, the healing start taking place. That's why we see someone that is just 7 months and we are telling you, madam, that we're going to bring out this baby, because we know that your life is at risk. So when we say that, it's not that we are happy bringing out a baby that is not strong yet, but we need to, because we need to save your life and save your organs. So when we do this, the placenta, mainly the placenta comes out, healing processes starts. However, some women may not present with these symptoms till after delivery. We call it sometimes atypical preeclampsia. And because they have gone home, they will be at home, the blood pressure will be elevated, they may not know that there is elevated blood pressure, there will be protein in their urine. They will not know because they are not health professionals, except if you come to the hospital. When you start having throbbing headaches, flashes of light, you are about to start convulsing. And if nothing is done, you may lose your life. You may have stroke, bleed into the brain, and you will die. So that is why you have to cultivate a good health-seeking behavior, especially when you are pregnant and when you have just given birth. Don't take anything for granted. Every woman that has given birth and is less than 6 weeks after you have given birth, you are still a pregnant woman for us. We still manage you as if you are pregnant until after 6 weeks. After 6 weeks, we evaluate you and say, okay, everything is fine, you can go. If after 6 weeks this thing continues, we will send you to internal physicians. We'll hand you over to those, because we see that our own, we are finished with gynecologist obstetrician. So my dear, don't attribute anything to village people. Don't attribute rather everything to village people. Don't attribute it to foam pressing. I actually made a comment on that post that foam pressing, I don't think so. So preeclampsia, severe preeclampsia, eclampsia, these are medical conditions that can complicate pregnancy and give you a very bad outcome. Thank you for watching to this point. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. Follow me at OBGYN Talks with Dr. Adazion. See you next time. Subscribe, share the video. Drop your questions on the comment section. I'll answer them. Thank you.